Thank you so much for that kind introduction. Complimenting my hair never gets old. So, when I first kind of saw the opportunity to be here tonight, I thought, perfect. This is the dinner for health policy conversations and for leaders in transforming health in this state. This is the perfect place for me to do my sort of legacy speech, to talk about what we have been able to get done at the department and to brag on my most amazing team that has been so dedicated. But needless to say, since about Friday night, I have not slept much, and have been with many of our team at the Emergency Operations Center responding to just the horrific impact of Hurricane Helene. I think they say that man plans and God laughs. So I furiously rewrote this to really just give you the latest on where we are with our response and what we're doing, because I think this is something that is not going to be done in a few days. It's not going to be done in a few weeks. This is an entirely different trajectory for the health and well-being of the region, and our state will and must respond to it in a different way. So to start, let me just set the stage with what's going on. Governor Cooper has called this disaster an unprecedented one, an unprecedented disaster that warrants an unprecedented response. At the height of the storm, we saw in Yancey County 107-mile-an-hour winds and 30 inches of rain hit the Continental Divide and fill into the valleys and wipe entire towns off the map. 400 roads were closed, 4 miles of I-40 between Asheville and Tennessee washed away. Water systems weren't just inundated with water and set aside, but entire pump stations and pipes were washed out of the ground and destroyed. Telecommunications already, my favorite thing growing up when I was in college at Brevard was my father would call me, and this was during his chatty phase of life, and he's now in his not chatty phase of life. But he was in his chatty phase at the time, and he would want to talk, and I would get in my car and drive over the mountain to take advantage of the already spotty cell service. But now, in many counties, even since we have been in this since Friday, many counties still have 0 cell service. A mudslide happened, and it severed the fiber line that feeds the backbone of the region and wiped telecommunications off of the map. Whole communities lost, lives washed away with it. So our team sprang to action. And first and foremost, we have been working around the clock to shore up our healthcare facilities. We have 22 acute care hospitals in the 25-county impacted region, and I'm happy to say that by Sunday night, all of them had been restored to commercial power because of some amazing work done by Duke Energy. In spite of about 1 million customers being wiped out, they prioritized to get the power back on. Now, a couple have fallen back off commercial power onto generator power, but nevertheless, we're working to get them restored. We have 91 nursing homes in the region. We've been in contact with every single one of them in spite of those challenges. We've got Starlink satellite dishes and satellite phones that are out to connect with folks, and by land and by air, we're delivering resources, including fuel, to refuel their generators. We have 121 assisted living facilities in the region that are caring for folks with that are disabled or with other needs. And every one of these facilities is challenged with every possible thing that we think is just so easy to manage every day, and they are stepping up heroically to the moment. people, their staff that are working there, all shifts, just came in and they're staying the night, sleeping in cots, sleeping on mattresses, doing whatever it takes to support the people that are in their care. I want to brag on Mission Hospital that has really stepped up in an amazing way in the region. They figured out a way, I mentioned or alluded earlier to the water systems in Buncombe County that have just been washed out of the ground. Mission Hospital figured out a way to pressurize their water towers with their own engineering, and they're bringing in tanks of trucks, tanks full of water, pumping it in their system, repressurizing it. We figured out that the sewer system could tolerate it, and they've restored water of their own accord. Because they know they cannot sustain bringing in 150,000 gallons worth of water every day, they are currently, as we speak, drilling 2 700-foot wells on their own property to restore water. They've brought in hundreds of staff from outside of the state. 1,000 staff have been sleeping overnight in their facilities. They've set up mini-marts for their staff with food and resources, and mega-marts with generators and chainsaws to support their team. They've been checking on their own team members to make sure they're okay. And after they figured out how to pressurize their own water system, Mission's taken over 5 hotels in downtown Asheville, pressurized their water systems, brought their own generators in to power those hotels so that they could have 500 hotel rooms for their staff to actually sleep and have a place to be. It's stories like this that give me the most hope about public service in these moments where people step up and do just truly amazing work. 25 of our 25 counties actually have pharmacies already open. The pharmacy manager at one pharmacy in Mitchell County's home washed away. And in that home were the keys to the pharmacy. And so CVS is working on making new keys, and our team has been working to get that reopened, but with that, we'll now have pharmacies open in all 25 counties. Walmart brought a mobile pharmacy into Watauga County to make sure that was immediately available. Walgreens has 2 mobile pharmacies stationed in South Carolina that are coming in, and now we have 126 pharmacies that are open in the region that has been so devastated that I just outlined to you. I want to thank the Board of Pharmacy who stepped up to create a pathway and a page where people could identify which pharmacies were open, because people were showing up at the hospitals because they didn't know where to go, because they needed to get their pharmacies refilled. We saw a similar challenge with folks that are in recovery from opioid addiction. All 27 of our opioid treatment programs in Western North Carolina have already reopened. All of our shelters have naloxone and opioid overdose reversal medication and are now connected to our OTP providers so that people, no matter their situation, can get served, and it doesn't matter where you were dosed before. We've put flexibilities in place so that guest dosing can happen. And the whole time that our team is working on this, I have been thinking in the back of my mind, my God, where would we be had we not expanded Medicaid? As of today, 551,419 people have enrolled in Medicaid since December 1st when expansion went live. That is a tribute to the faith leaders and the civic organizations that stepped up to break myths and to bring people together. That is a tribute to the technology that we revitalized during the public health emergency so that now more than 1/4 of applications for Medicaid are going straight through without ever having to talk to a person. That has never happened before in North Carolina. That is a tribute to the really clever policy flexibilities that our team put in place to be able to extend all children 12 months so that our county workers would not have to redetermine children during the unwinding of the public health emergency. By the way, the second state in the nation to take advantage of that. We pushed forward to make it possible for people to get Medicaid expansion as quickly as possible, and think for all the flexibilities we're putting in place to serve people in this disaster, how fundamentally different is their experience that they have Medicaid coverage. And I'm happy to say that disproportionately, Medicaid coverage is being accessed in our rural communities. One of my favorite stories as secretary was actually being with Governor Cooper on December 1st when he gave Penny her card. And Penny had bore her soul and told her story about her fights with her medical ailments, put it all out there. Even though her family had told her, don't tell those stories, those are private, she laid it out bare for everybody to see to help people understand the impact of not having health insurance. It was also Penny's story and so many others as we traveled around the state where people would talk about the peace of mind that they now had, that they had medical coverage. It would always be followed by a story of someone saying, but what do I do about the $3,000 in medical debt that I accrued while I was uninsured? That story led us to partner and figure out a way to put forth the first in the nation initiative that will forgive $4 billion of medical debt for 2 million. North Carolinians. But folks, let's go back to the disaster. We have 29 shelters that are open, serving over 1,000 people. We've served so far over 30,000 hot meals at 3 mass feeding sites in McDowell, Watauga, and Buncombe County. To augment that, we have had hundreds of thousands of pounds of water and food and other supplies going into every single county in the disaster-impacted region. I was with the governor on Monday. The minute I-26 opened, we had 60 tractor trailers pre-positioned in South Carolina coming up I-26 full of food to a distribution site that we set up at Asheville Regional Airport. I was on the tarmac when a C-17 landed full of food and supplies that was offloaded by the military and the National Guard into 2 Chinook helicopters and dropped into every single county that was impacted. That was Monday. We have been now receiving 40 semi-trucks nearly every day while our road crews are working around the clock to get 400 closed roads down to 200 closed roads, to increase power access from the outages of 1 million to now only 400,000. We stay focused at this time when everybody is fending for themselves. We are so focused on our most vulnerable people. Medicaid and Medicare data allow us to identify the most vulnerable folks that are dependent on durable medical equipment, oxygen tanks, other supports in their home that are likely impacted because they don't have electricity. 11,576 is the number of people that we are trying to find in this system. We're reaching out, calling all of our prepaid health plans. Every managed care company that we have in the state has stepped up. They're calling their folks, and when they can't get a hold of them, we're sending out National Guard and FEMA teams to go find them, to make sure that they are okay. We have 2,667 kids in foster care. We're finding every single one of them. We have 1,000 people on dialysis being served by a dialysis provider that, as of this morning, had 13 of their 14 dialysis providing facilities reopen. One, they needed a CON flexibility, which we have figured out, and we are getting them reopened as well. And of all the long-term care facilities that I mentioned earlier, we've only had to transition patients out of 7 of them, but we stand ready to support them any way we need. We have 220 ambulances ready to transport patients at a transport lily pad site that we have set up for patients to move them wherever they needed to go. The Long-Term Care Association has stepped up to identify empty beds throughout the state, as have our hospitals. I highlight the importance of food and supporting our most vulnerable North Carolinians because this room knows better than most that what really drives health is everything that happens outside of the provider's office. Food, transportation. It has been this work in North Carolina leading the nation with the first in the nation pilots to support people's health and well-being with our Healthy Opportunities program. One person in this room is happy about that. Our partnership with FHLI and NC Care 360, thank you so much. And folks, it's working. We've seen the pilot serving hundreds of thousands of people, tens of thousands of people with hundreds of thousands of services. And we have seen statistically significant improvement, a reduction in emergency department visits, a reduction in hospitalizations, and a savings of $85 per member per month in insurance costs. I want to give a huge shout out to Betsy Tilson, who is here, who is the heart and soul. And she would immediately, if I gave her the mic, give everybody else credit, so we won't give her the mic. But it is a huge team effort, of course. As we look forward and think about how do we move just from response, we're thinking about recovery. We've got SNAP benefits teed up. We have 130,000 households in the disaster-impacted region that are on SNAP benefits. 255,000 people in those households getting benefits. We've put our waiver in, thank you, this is our regional administrator. I was pushing on him earlier for my waivers. He's here to help. We put our waivers in so that way people can use their cards for hot food. So that if they go to a gas station and get a hot dog, they can pay for it as opposed to just being able to go to a grocery store. So we're working on that waiver. We've put in our replacement benefits waiver so that way everybody who just lost their food or worse can have their food replaced. And we'll be also putting an application for our DSNAP benefits, which will really open up everybody in the disaster-impacted region to have access to food services. Already tens of thousands of people have applied for individual assistance support, and more keeps happening. As we think about the most tragic aspects of this, we know we're going to see in this disaster many deaths. We've already had 56 deaths attributed to the disaster. We know that number will grow because of the size of it. We know how traumatic this moment is now. We have mental health clinicians in shelters. We've been promoting the disaster distress line, and we will apply for the SAMHSA crisis counseling program so that we can have people in the field going door to door to support people with access to care. As I think about long-term recovery, I'm so happy that we have built over the last several years an infrastructure and a totally transformed mental health system of care in this state. $835 million invested in behavioral health, $130 million for a crisis system, increasing behavioral health urgent cares by 50%. $99 million for the justice system so that pre-arrest diversion, jail-based treatment, reentry supports can help break the long-standing cycle and stigma between health and well-being and the justice system to destigmatize behavioral illnesses. $80 million, thank you. $80 million for kids and supporting kids and mental health in schools, and I'm so grateful for this support, $200 million to increase behavioral health rates for the first time in a decade. I think about Gracie Parker, who is an 11-year-old in Macon County, who I have not been able to get a hold of, and I'm still trying. She is a youth advocate for mental health, who stood up and told her story about losing her mental health counselors in school and started in our state the mental health movement for children and doing mental health rallies for kids. I think about our launch of 988, which launched incredibly strong in our state with an amazing answer rate, and our Peer Warm Line, which is a first of its kind that actually provides people with lived experience the opportunity to be the ones that answer the phone so that if you're not in crisis but you just need someone to talk to and listen to, it's there. Where would we have been had all of this not been done on the other side of this storm? Moments like this, disasters like this moment, I think help show us the best of us. they also show us the size and the scale and the impact of our team. And when we think about the work that we do in these on moments, it makes us think even more about the work that we have to do off the field to be ready. So often those moments are forgotten. We have an amazing team, and I count as part of that team my partners at the legislature, who have come together in a bipartisan way to advance the agenda for health against a lot of headwinds to make a really meaningful difference. And we haven't always agreed, but we have always agreed on this, which is that core to our mission is supporting the health and well-being of the state, and that their constituents are my constituents, and we can figure out a way to work together because the people are what matter. No matter what happens in a couple of months, the people we serve will not change. I get the great privilege of standing here and telling the story about this amazing work, about our partners at the local level and the federal level, about our private and nonprofit partners, about everybody who comes together in these moments when everybody is watching, and even more important, in the moments when nobody is watching. I am so grateful to have the privilege to steward the best team in the entire state at the Department of Health and Human Services, the best team in the nation. They are truly amazing. But there are also people in our lives that make a big difference at our most difficult moments. And I want to also thank two people who are here who will never call me secretary, no matter what happens. And that is my partner Angelo, my brother Jesse. He's the one with the hair like mine. I think you all get to see the dressed up me, and they get to see the real me. And in the toughest times when we're doing disaster response and others, they step up to support me in ways that really matter. Folks, we've gotten a whole lot done in the last 3 days. Huge stuff done. All made possible because of what we have gotten done in the last 3 years and the last 8 years. We have so much more to do. It's going to take the continued perseverance of this room, of this community, to push us forward to what's next, to solve rural health, to make sure we can give access to care and what drives that in rural communities, to think differently about aging, because guess what? We all have a vested interest in that, and the current model for aging care is not working. But if what we have gotten done is any indicator of what we can do, I'm bullish and excited and eager for the ongoing chapters at the department and in this community and this state. Thank you so much.